Okay, we're live. It's Thursday at 12:30. I'm Dr. Tenenbaum, and I'm going to be talking to you today about breast augmentation. I'm here with Lisa.
Hi, guys.
Before we get started, while I'm waiting for a few people to join, I was going to give you a little tour of the office. So first, this is when you first walk in, but before you do that, you come through our beautiful waiting room, which I'm going to show you. Got some beautiful flowers from a post-op patient yesterday. Hi, Jenny. Here's Christy, one of our lovely staff members who's here to greet you when you walk in. And then after you check in, come around here, but first let's say hi to Gina. Hi, Gina. She's the cutest. Okay, this way is where we see patients, down this hallway. Our administrative offices are along this row. There's my office. We're going to go in there in a little bit. And down this hallway is where we do more of our non-surgical procedures and some surgical procedures. I have a blepharoplasty today that we're doing in the office. And spa treatments. Hi, girls.
Hi. Spa room.
That's our cute Jenny McGugan, and here's her little room to get a relaxing facial or a hydrofacial or a peel or all therapy or any number of amazing treatments. Okay, so I am going to be talking to you today about breast augmentation and answering some questions. So please feel free to ask me questions. I'm going to turn it back on myself. I'm sorry, I'm using the phone today, trying to go back and forth, which is a little more awkward than the laptop that I used last week. Okay, so let me give you a rundown on breast augmentation. Obviously, if this is something you're considering, you of course would need to be evaluated in person to discuss your goals and how we can best meet your goals with the available treatments. But in general, breast augmentation is a very common procedure around the world and in our country for women who either are just interested in having a larger, fuller breast, or often after having children, or any number of physiological processes where maybe there's a weight loss involved, or somebody's gotten more fit and lost some body fat, and the breasts tend to deflate over time and may even droop a bit. With the drooping, we can talk about things like a breast lift, which is also known as a mastopexy. That is very commonly combined with a breast augmentation when the tissue is more significantly drooping. But today I'm going to focus more on breast augmentation, which is enhancing breast volume or restoring breast volume. I have noticed one of the trends lately over the past several years is really trending more towards a much more natural result, smaller implants. A lot of women who come to see me, a common request is that they really don't want anybody to know that they had a breast augmentation. Perhaps they're using some padding in their bra now and they just don't want to do that anymore. It's really for them to feel comfortable in their own skin, feel more comfortable in a sports bra at the gym or in a swimsuit at the beach, and it's really not something that they want to be terribly obvious or look very augmented. So that is a definite trend, a more natural augmentation, smaller implants. Some women are even coming in getting their implants downsized or removed. So when women come in and want to talk about breast augmentation, the first important discussion tool is, of course, overall health and breast health. So any history of breast cancer in the family or in the particular patient, updated mammograms, etc. And then after that, we want to talk about goals. So what are your goals? I just told you that I think a trend is trending more towards a more natural look versus a more augmented look. Sometimes women bring in pictures, or they've looked on our website and they've seen pictures. Sometimes they bring a friend who's maybe been through the process, and so they may know a little bit about the procedure already. Once I've kind of talked to them about their goals and what they're hoping to achieve, and I've decided if I think that's something we can achieve, then we can talk about the procedure itself and the choices that we make. So the procedure itself, typically most surgeons are going to perform this procedure under general anesthetic. So you are asleep in an operating room or a surgery center operating room, but typically you would go home the same day. So an outpatient procedure. Typically, you would not require any drains, and overall, it's a generally fairly easy procedure. The recovery is generally very reasonable. The first thing we talk about is incision placement. So where are the scars going to be? A lot of women want to know that. There are several options. The first and most common is in the inframammary fold or the lower crease of the breast. The second is around the border of the areola. The third is in the armpit, and last and least common is through the belly button. The reason that the inframammary fold is the most common is because there have been a lot of studies to show that it's actually the safest. You can use any type of implant through that incision. You can do any type of procedure. And revisions that you may have later on in life can all typically be done through that incision. Sometimes if your primary breast augmentation is done through an armpit incision or an incision around the areola, then sometimes when you come back for a revision later in life, that incision can't be used again for whatever reason, and then we're going to do an incision in the inframammary fold. There's also been shown to have a lower risk of scar tissue around the implant called capsular contracture if we use an inframammary fold incision. And so for all of those reasons, it tends to be my favorite and the most common. The other reason it's my favorite that I always explain to patients is that to me, it actually is the most hidden incision. If it's planned well, if your surgeon does a good job planning your surgery, then the scar really should be tucked right in that crease. And unless you are looking right in that crease, you typically won't even notice it. And so I really prefer that incision. When some women ask me about the armpit incision, for example, I'm just very honest. I don't love that incision. I think it does not offer as much control over the surgery for your surgeon. But more importantly, to me, it's the least hidden. If you're wearing a strapless dress and you're at a wedding and you're dancing and your arms are up and you have a scar in each armpit, to me, that is the least hidden scar. So I will do it, but I don't love that one. Next, we talk about where we place the implants. So people think about above the muscle or below the muscle. Above the muscle or subglandular or subfascial. So there is a covering on your pectoralis muscle called your fascia. And when we do the implants in front of your muscle, we typically try to protect it at least with that fascial covering. This is a great option for women who are very active and fit, and maybe they lift a lot of weight and use their arm muscles a lot, or their pectoralis muscles are quite developed already. This is a good option for them. The more common way that I would say I do it is partially behind the muscle. I think it offers a very natural look. The pectoralis muscle kind of blunts the upper portion of the implant, which makes it adopt a bit more of a teardrop shape and can look a little more natural. There also is some data to suggest that perhaps there's also a lower risk of capsular contracture behind your muscle. However, I think some of that data is old, and as more and more data comes out with the newer implants, I'm not sure that that's going to be the case anymore. The types of implants. So I want to talk to you about the types of implants, and I want to show you some implants. And then after I show you some implants, I want to show you how we select implants with patients. So the types of implants. So there are saline implants, which is a silicone shell filled with saline or salt water. The main benefit of saline implants is that when they rupture, they're like a water balloon and they just rupture, and your body will absorb that salt water, making a rupture very obvious. Typically, we don't need MRIs, ultrasounds, mammograms to show us that it's ruptured. Typically, it's a very obvious deflation of that saline expander. One of the downsides to saline compared to silicone, however, is many of us don't feel they look or feel quite as natural, and I would absolutely agree with that. There are also silicone implants. So within silicone implants, there are several different kinds of silicone implants. All the gel nowadays in our country is what we call cohesive gel, meaning it's a solid gel. It's not a liquid silicone. It's a more solid silicone. So if you cut those implants in half, it's solid on the inside. Now, between the different implant companies and then different styles of implant that each company make, there are different levels of how solid those implants are, ranging from about the consistency of like a Jell-O up to a firm gummy bear. And then there are implants in between. The benefit of cohesive implants is that, number one, if the shell fractures or the implant ruptures, all of that gel can stay contained. It's a solid, it's not a liquid, it's not leaking anywhere and traveling around the body. And number two, the benefit is that it holds its shape. So depending on using a round implant versus a teardrop shaped implant or a contoured shaped implant, the upper portion of that implant is going to stay a closer shape to the implant that it is because it's a more solid implant. The other benefit is that they still look and feel very natural and soft. The silicone, even though it's a solid, like I said, it still feels very soft and natural. So let me first show you some of these implants in terms of the different types of gel and what the difference is. I'm going to show you one manufacturer, Allergan, today, just to kind of prove my point of the different levels of cohesivity. And then I'm also going to show you some implants, differing implants in terms of their size and projection. So let me turn my camera around here. Okay, so first I want to show you, these are Allergan implants. These are all the same size implants. So these are all, these are my different projections. Let's first look at these. Okay, so these are all the same size implant. They're all 365 cc full projecting implant. I'm going to tell you what that means in a minute. But that's 3 different kinds of gel that it's filled with. It's all silicone, there's no saline here. So this gel is called Allergan's. It happens to be called their responsive gel. So it's still cohesive, but you can see it's pretty soft. And when I turn the implant on its side, it kind of collapses in the upper pole. This feels really soft and gives a very natural look. Again, when it's behind the muscle and turned on its side, it gives a bit more of a teardrop shape, very natural. The next is called a soft touch implant. This is a bit more cohesive, a bit more of that gummy bear. It's very, very soft, but you can see that it holds the upper pole of projection here a lot better than the last one. A little bit less rippling. Again, when it's in the body, it's under some tension, so very little rippling with this implant, and holds that upper part of the breast, that roundness to the upper part of the breast a lot more if somebody is looking for that more of that look, the round upper pole. Finally, the most cohesive gel that Allergan produces, they call it their cohesive. So this is the most cohesive or the most solid. You can see that it really holds its shape on its side. It's a very rounded look, a lot fewer ripples. So for somebody who either has a lot of loss of tissue in the upper part of the breast or really is looking for that very round upper pole, this is a good choice. I will say that personally, I very rarely will use this implant in an aesthetic augmentation. I would use it more in a reconstruction. The soft touch is above and beyond my very favorite implant. I think it provides that nice cohesive look, but still very, very soft and doesn't look too augmented. The responsive I still like, especially for women who want a very, very natural, more of a teardrop look. So those are the 3 different levels of cohesivity. Okay, next I want to show you different projections. So you've probably heard or researched or heard people talk about different projections of implants, like low projecting or moderate or medium projection, high projection, extra projection, full projection. What does that all mean? Well, it's a measurement of, sorry, I'm not that great at this phone holding it still. It's a measurement of the size and volume of the implant in terms of the specific width and volume, how far it projects. So let me put this on the table and show you what I mean. So this measurement, how far it projects off of the chest wall. Okay, I have a quick question I'm going to answer. Do you use the soft touch when doing both a lift and an augmentation? Absolutely. I think the soft touch implant is a perfect choice for women who need a lift, but also need, with that lift, some upper pole or the upper part of the breast fullness. The soft touch really fills it out, but still very soft and natural. So great question. Thank you for the question. It's my favorite implant for that. Okay, back to projection. So all of these implants have the same width, meaning this measurement here, how wide the implant is. This is a moderate projecting implant. This is a full projecting, and this is extra full projecting. So for the same width, you can see, let me kind of show you from this angle, moderate projection, more natural look, full projecting, a little bit more augmented, round, more augmented look, and extra projecting, the highest projection implant. Below moderate, there's also a low plus. I don't have that example on my table right now, which again, for somebody who's looking for a very natural result, and then also a low. The low, I would say, I typically only use in cases of asymmetry where I need something to fill out the breast, but I want almost no projection. The low plus and the moderate are great choices for women who want a very natural look. The full for somebody with a bit, who wants a bit more round, full, a bit larger look so that we can still fit it on their chest wall, a little bit larger full look. And then the extra projecting, I'll be honest, I really only use these in reconstructions for women after mastectomy. I don't think that this is a great implant for augmentation purposes. I think it looks a little too unnatural. So the full and the moderate are probably the most common. Why does this matter? Well, tissue-based planning for breast augmentation is the #1 most important tool that a board-certified plastic surgeon has to help you get the best result possible. So we want to use your tissue, your measurements to really get the right implant that's going to fit your body. Then based on that, we kind of can look at different volume and different projections. So here's another question. What is the projection of the soft touch, or do they come in all options? They come in every option. Again, this is one company, Allergan. Mentor is the other, and Sientra is a third. With all the different types of gel, Allergan actually makes all the sizes, all the projections in all 3 different types of gel. So we really have a ton of choices available to us. Okay, so I don't have a ton of time left, but what I want to do before we go is I want to show you one of the things we can do in the office to help women select implants, and that is using 3D simulation with our Vectra system. It's a 3D camera that we can use to simulate breast augmentation. We just published a randomized controlled trial looking at 3D simulation and patient satisfaction, and we actually found that women were not necessarily more satisfied if they had 3D imaging than if they didn't. However, many more women are aware of this technology and they're asking for it. What I find it invaluable for is really trying to get inside my patient's head, trying to understand if she says to me, I want to be a very natural small C cup versus I want to be a small D cup or a full D cup. What does that mean to her versus what does it mean to me? You know, bra sizing is not terribly scientific, so to be honest, saying you want to be a full C or a small D doesn't mean a lot. What I'm more interested in is what is the look you're going for. So this system really allows me to get in the patient's head. So let me just walk you through a particular patient here. So this is the system. So she's had her photographs taken 2-dimensional, and then this is a 3-dimensional photo. Let me just show you as I move it around you so you can see that it's 3-dimensional. So this is a before picture of this patient. What this software allows me to do, give me a moment here while I kind of program it. So we landmark the patient and make sure that we are going to measure everything appropriately. Okay, so now I have some basic measurements and then I can select implants. So this particular young woman has already had her surgery and she was interested in a fairly natural look, but still wanted to be a nice sort of mid-range C cup. Didn't want it to be terribly obvious, but wanted to definitely notice the difference. And so what I wanted to do for her was look at moderate projecting implants to give her that natural but still a full look. We start out by simulating some different implants, and I can help decide that, again, based on their chest width and their dimensions. So this is the simulation. Let me show you the different views we have. So it's kind of that before and after. I don't love the front view of this camera, but I really like the side views to help show the patient the difference. So this particular implant that we're simulating is 345 cc moderate projecting implant. The other view I like is this one because it's sort of like the patient looking down at her own chest, to determine whether or not this is something she has in mind. And then based on this, we can go back and say, okay, do we want to look a little bigger, a little smaller, a little fuller? And it helps us communicate. Once we communicate, then she gets the real sizer. I have a million of these guys in the office. She gets the real sizer to try on in her bra to make sure, again, that it's what she was going for. So let me show you, hold on one. So I'm going to show you this particular patient's pre-op and post-op, and we used the 345cc moderate projecting implant. And I'm going to show you that side view because that's what I showed you on the camera. Let me just pull it up. Oops, that didn't work. Okay. Turn you back around here. So you can see it's pretty close to what that camera simulated, and she had a beautiful result. She also happened to have an inverted nipple repair at the same time, which is very pretty and very stable. Let me show you the, oh, there's my water, sorry. Kind of a side view, how pretty that looks with the inverted nipple repair and a nice natural soft augmentation. So she did great. And I think using that software is very helpful. What type of implant did she get? Somebody asked. Great question. So she had a soft touch implant, which again, you can see it filled out that upper pole of her breast, but didn't look too round or augmented. It looked still really soft and natural, but gave her that fullness. If we had used a responsive gel implant, it still would have given her that upper pole fullness, but maybe just slightly more teardrop. One thing I didn't show you was the teardrop implants. I forgot to show you that. So let me just show you that very quickly. There are actually teardrop shaped implants. The gel in here is all the most cohesive because these are designed to hold their shape. So you can see on its side, it's a teardrop shape and it holds its upper pole. Okay, so this is a moderate height, moderate projecting implant. Projection again is this measurement. There are also some taller implants. Again, this really comes, this is even more important to be using tissue-based planning. You have to plan for the patient's body habitus so that these look great and natural and normal. And those are great used to, especially for women who are looking for a very natural shape or may have some different deformities of the breast, like a tuberous deformity or constricted deformity. Those can do a really good job of helping the surgeon to actually shape the breast itself. All of the teardrop implants nowadays are textured implants as opposed to the round. You can get a smooth versus a texture. So remember, these I showed you, these are smooth, a smooth shell versus a textured shell. So that has become a little bit more important over the last couple of years. Some of you may have heard of something called breast implant associated ALCL, anaplastic large cell lymphoma. So it's extremely rare, but we do think it's a very rare type of lymphoma that can be associated with a textured implant. So because of that, many of us are using fewer textured implants and really saving them for cases where we think we really need them and they're really offering some added benefit. If I think a smooth implant is going to do a great job, then I'm going to use a smooth implant just to try and avoid that complication. Somebody else asked a question, how soon after having a baby and breastfeeding can you have a procedure? Great question. Typically, we want to wait for a few things. We want to make sure that after you've stopped breastfeeding, that you're no longer producing any milk, and you're no longer lactating at all to help decrease your risk of infection. So that's the first thing. The second is we want to make sure that you are back to your sort of stable size in terms of your weight, that you've lost your baby weight and you're stable, as well as the breast size themselves. So the breasts are back to their kind of stable weight and they are where they're going to be. We don't want to operate too soon and then have changes. It's going to lead to a higher revision rate down the line. So that's my spiel. Does anyone have any other, my afternoon clinic? This has been really fun. I hope everybody learned something. Obviously, if you want to come in and have me evaluate you, I'd be happy to do that. Give us a call, 314-996-8800, and I would love to chat with you about any of your needs. I'm going to get back to my clinic this afternoon. I'm seeing a few more patients this afternoon, and I've got an upper lid blepharoplasty or an eyelid lift that we're doing in the office as well. Thanks, guys. See you soon.